Hi everyone, happy Woman Wednesday. I hope you're doing well. Today we're going to be talking about breast and chest health part 4. This time focusing on top surgery and gender affirming surgeries. So we'll give it a couple seconds for folks to join the space and get our fellow co-hosts in the room, and then we'll get started. All right, looks like we got Whitman-Walker. Just waiting for Instagram to catch up. Cool. Thanks for joining, Whitman-Walker. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The Community Health Team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Team. Today we're going to discuss breast and chest health part 4, but focusing on top surgery. Before we get into it, we'll kind of talk about a few things that we learned last week about breast and chest health and pleasure. So one thing we learned is that with any chest-related surgery, you have to consider the time costs involved in the procedure and recovery. While the initial recovery should only last from 1 to 5 days, it could take anywhere up to a few weeks before all of the pain and swelling go away. You also need to arrange vacation time away from work for the day of the procedure, as well as several days afterward while you recover from the initial pain. And if you've got a more physical job, you might need even more time away from work. We also learned that your medical provider may prescribe strong pain medication that will make operating a vehicle dangerous, so you'll need to arrange a ride from and to your procedure. Whether that's a friend or someone that you're hiring, you'll just need to arrange transportation. We also learned that a common risk with breast augmentation surgery is the need for a follow-up surgery. This is to correct any complications that may arise from the surgery, and also some people later on desire a different size of implant or lift as their skin stretches over time and kind of their breast change over time. And finally, we learned that when your nipples are stimulated, they shoot off sparks in the genital sensory cortex, and this is the same area of the brain that's aroused by vaginal/front hole or clitoral stimulation. So again, when your nipples are stimulated, they shoot off sparks in the genital sensory cortex, and this is the same place that vaginal or frontal clitoral stimulation is aroused by. So to start off, what is top surgery? According to healthline.com, top surgery is a reconstructive surgery performed on the chest for those who wish to alter their chest size, shape, and overall appearance. This surgery is typically performed by a plastic surgeon who has specific training in transgender or gender-affirming surgeries. Some of the benefits of top surgery, there's an article that was published in the Journal for Adolescent Health that highlights that a large majority of trans and gender expansive folks who experienced decreased gender dysphoria and an increased sense of self-confidence and comfort in their body after completing their surgical step in their transition or alignment process. So gender dysphoria is basically if you don't feel aligned with the gender that you were kind of born or assigned as. So folks basically felt more aligned with their gender after they had their surgeries and felt more confident about themselves after their surgeries. So research also shows us that very few, if any, trans people regret the decision to get their top surgery or their gender affirming surgery. Healthline.com also emphasizes that for many trans and non-binary people, this is more than just a surgery. It's a necessary step in order to feel whole and better align with one's gender and body. This can be an emotional and challenging process to go through, even if it's something that you know you want and know that you need. But let's get more into top surgery. So top surgery procedures can be done for individuals who are looking to achieve more masculine or flat appearing chest, or for individuals seeking a more feminine sized or shaped chest. If you're looking for a surgeon, you can visit transhealthcare.org for a listing of surgeons by procedure and insurance type. Female to male or female to non-binary, or FTM or FTN, top surgery involves removing breast tissue and contouring the chest to reflect a flat masculine or male appearance. Male to female or male to non-binary, or MTF or MTN, top surgery involves using saline or silicone implants to increase the chest size and augment the shape in order to achieve a more feminine or female appearance of the chest. Top surgery costs can vary greatly depending on your insurance coverage and where you live and the surgeon that you use. So according to topsurgery.net, the average range for cost of an FTM or FTN, or female to male, top surgery is currently between $3,000 and $10,000. The average cost range for MTF or MTN, or male to female, top surgery varies greatly depending on factors such as body size, body shape, and desired breast size. According to the transgendercenter.com, the average cost range for the surgery is between $5,000 and $10,000. Please also note that a hospital or facility fee and anesthesiologist fee is also usually added to this total bill, so it won't stop at the $5,000 to $10,000. For FTM or FTN top surgery, again, female to male top surgery, topsurgery.net shares that FTM or FTN procedures take between 1.5 to 4 hours, and there are a number of different procedures that can be used to achieve a more flat chest or a more masculine or male-looking chest. The most common types or techniques that surgeons will use are called the double incision, the periareolar, and the keyhole. Now, these are super important to discuss with your medical providers to see which one of these options is best for you. But they basically kind of differ depending on how much breast tissue you're starting off with, how much would need to be removed, how much skin would need to be removed to kind of make your chest appear fully flat. So just heads up on that. If you were doing MTF or MTN or male to female top surgery procedures, this is also known as breast augmentation or augmentation mammoplasty. And so MTF and MTN top surgery typically takes between 1 to 2 hours, and you are put under general anesthesia for the duration of the surgery. The breast augmentation procedure your surgeon uses will vary based on your desired chest size and the type of implant used and the incision location. In preparing for surgery, there are a number of things that you can do, but some tips include avoiding alcohol up to the week leading up to your surgery. Stop smoking if you're a smoker of any kind. It's recommended that you stop smoking 3 weeks prior to surgery, and as smoking can interfere and cause complications with healing. You want to discuss your medications with your provider and your surgeon, just to make sure that everything that you're using is gelling well together before and after surgery. You want to set up your transportation, of course. Again, before and after your surgery, you'll need someone to take you to and from the hospital. And finally, you want to dress prepared. So bring comfortable, loose clothes that zip or button up in the front to make getting dressed and access to your chest a little bit easier after your surgery. You can also plan to bring a pillow in the car with you, just to make sure that when you do use your seatbelt, you're not having it directly pressing against your freshly, medically treated chest. For recovery time, for top surgery varies from person to person. People who get FTM or FTN or female to male top surgery generally return to work or school about 2 weeks after surgery. Those who get MTF or male to female or MTN top surgery can typically get back to work or school after 1 week. Day 1 and 2 of the recovery are usually the most uncomfortable, and this discomfort can be a result of the anesthesia wearing off, as well as the compression binder or surgical bra that you're wearing. And those are things that are holding the dressing over the incisions or grafts tightly in place on your body. Healthline.com shares the following recovery tips. You don't want to shower. Many surgeons will instruct you not to shower until your post-operative appointment when the dressing is removed. You want to use ice packs. Most people experience some swelling and bruising after surgery, but the extent of swelling and bruising varies greatly, so ice packs can help to decrease the inflammation and manage pain. And you don't want to lift or do any strenuous exercise. Lifting anything heavier than a gallon of milk isn't recommended in the first week of recovery. You want to take care of yourself. The best things you can do to speed up your healing process are to rest, eat healthy, refrain from smoking and drinking, and listen to your body. And you want to use scar treatments. Over-the-counter scar treatments can also expedite the healing process as well as just decrease the scar tissue and redness. And then finally, just, with any surgery that someone takes on, there can be risks and complications. But those are things that you can discuss with your provider and just learn more about what, may happen from the surgery. If anything, I think a lot of people will either experience, failed nipple graft if they were doing FTM surgery, or have visible scarring, or they'll want to do an additional surgery to get a desired result of breast shape or size that they were wanting. They might also experience some loss or reduced nipple sensation. And for folks who are experiencing MTF or MTN top surgery, complications include loss of nipple sensation, inconsistencies in the appearance of the implant deflating or rupturing or being displaced, and just needing additional surgeries to obtain the desired result again. If you've got questions about gender affirming surgery and how to prepare for surgery, You can visit our website at whitman-walker.org and search surgery to see our Preparing for Gender Affirming Surgery resource. You can also email our trans health team, our gender affirming care team, at transhealth@whitman-walker.org with any questions you may have. And if you are in the DC area and you need to access HIV or STI testing, please give us a call at 202-797-4439. You can schedule a free HIV or STI testing appointment with us in Southeast or Northwest DC. But just wanted to thank you all for learning a little bit more about breast and chest health with a focus on top surgery. And we'll have one more of these series for the breast and chest health series coming up in like 2 weeks. But next week we're going to be having a really fun topic, talking about Pride and some of the music icons in our lives and their LGBTQ influences. So that's next week. But before you go, we want to give you a few reminders about COVID-19 and vaccines. If you haven't already gotten vaccinated, if you've already been vaccinated, congratulations. You're taking a really big step to helping keep your loved ones and yourself and your community healthy and safe. We've had multiple variants soaring all around all the time, always on the spread and always on the rise. So it's understandable if you want to keep wearing your mask, as the vaccine isn't 100% effective, although it's very effective at helping prevent it's very effective at helping keep people who get COVID pretty healthy, like they don't get super sick. It helps keep people out of the hospital with COVID, and it helps keep people from dying of COVID. So the vaccine is pretty effective, but it won't stop you from getting COVID per se. But you'll get a very mild version of COVID compared to what you'd have if you weren't vaccinated. If you haven't been vaccinated and you're looking to get vaccinated, Whitman-Walker Health has COVID-19 vaccine available. You can give us a call at 202-207-2480 to schedule an appointment. And if you're having trouble making an appointment with us, or we're just not close to you, or not a regional area you can access, you can always go to vaccines.gov and see what vaccine sites are near you. But for DC residents, you can go to vaccinate.dc.gov or call 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but be mindful of masks and keep your distance, but especially when you don't know whether a person has been vaccinated or not. Thank you all so much for tuning in. Please follow us at Whitman-Walker on Facebook, Twitter, and Instagram, and keep up with our website and resources at whitman-walker.org. You can, again, call us for an STI or HIV testing appointment. Just call us to make an appointment. It's 202-797-4439. And please follow our Whitman-Walker family on Instagram as well, at RealTalkDC_ and at NoFilterDC. Have a great rest of your day. Bye, everybody.